is not just about Groundhog Day.
It's certainly not.
Today is also National Wear Red Day, as you can see that we are both wearing red to support the cause. It's a nationwide campaign by the American Heart Association to raise awareness about the fight against heart disease, especially for women. And our first guests are here to tell us why this campaign is so important. And you can see that they brought some equipment with them because Ron and I are going to have our blood pressure taken this morning as well, right here in the studio. It's something that you can do today for free. We'll tell you how in just a moment, but first we want to welcome Dr. Esa Davis and Dr. Katie Berlacher. Thank you so much for being here.
Thank you. Thank you for having us.
So this is such an important day, and you're going to see red all over the city. How did this campaign really get started to bring awareness to this?
Go ahead.
Well, I think, it started a number of years ago when we recognized that the awareness of women in terms of understanding that heart disease is the leading cause of death across America was extremely poor. I think the first time we measured it was about 30% of women recognized that heart disease was the leading cause of death. The Susan Komen campaign does such a great job of getting out the news about breast cancer, but that's actually not the leading cause of death across America.
Yeah, and Esa, tell us about the specifics for women. I think that it's like, there was a new study that we were just reading. It's more deadly than breast cancer?
That's correct. It's the number one killer for women. Wow. And a lot of women don't realize that. But yes, cardiovascular disease and stroke are the number one killer for women. And about one woman dies like every 80 seconds from heart disease.
Unbelievable.
Well, let me ask also, what are some of the things that women out there and men, how are there symptoms? How do they know? What can they go about to find out if this is something that might be impacting them, and what can they do about it?
Yeah, so the best thing that they can do is learn what their risk factors are. And some of the major risk factors for heart disease are high blood pressure, high cholesterol, diabetes, if you smoke, if you have a family history, if you're overweight or obese. All of these can put you at risk for heart disease, and all of these things can be detected if you talk to your doctor and know your numbers.
And you are actually going to take my blood pressure. Yes, so we'll do that while we're doing part of this interview. And I explained to you guys prior to this, I do have a family history of high blood pressure. And I was also preeclamptic when I was pregnant with my first. Not with my second, but with my first. And I know that that's primarily high
so that's one of the really important non-traditional risk factors that affects women, obviously more than men, because men don't get pregnant.
Right.
At least not yet. Researchers are still working on it.
That will be your segment next year, right?
Yeah.
So gestational diabetes and preeclampsia and hypertension during pregnancy are risk factors for women to develop cardiovascular disease later on in life. So for you, even though it goes away after you're pregnant, it's something that we need to talk about and pay attention to.
All right, so what is she doing right now, and how is this going to tell us?
Right, so right now she is checking her blood pressure, and so as people may not be aware of what high blood pressure actually really is. So high blood pressure is when the force of the blood in your blood vessels is too high. So it's pressing against the sides of those blood vessel walls a little bit too high, and then that over time can damage the blood vessels and also causes the heart to work harder against that high blood pressure, and that's one reason why it leads to heart disease. The other thing it can also do is it can harm the kidneys. It can also, increase that blood pressure in the brain and cause a stroke. So, yeah.
One of the things you can always do.
How am I looking?
Right,
118 over 78.
Wow, that's
perfect.
Better.
Yeah.
So can we talk about the new numbers, because I know that the guidelines have kind of changed for that, right?
Yep.
Yes.
So you are actually in the normal range. So normal now is less than 120 over 80. Elevated though is now between 120 and 129 over 80. So that's when you start to get over 120, that's where you should start to kind of pay attention and start to look more at your diet, exercise a little bit more, keep track of your weight and things of that nature to keep it down. And then there's 130 over 90, which is now stage 1. So there's no more kind of pre-hypertension. We had this kind of borderline or pre.
Right.
Now it's just stage 1. And that's good because you can come in and have a conversation with your doctor about what you need to do to lower that.
I'm always wondering also, with those two numbers, what does that mean, the 120 over the 80? What is the 120 and what is that 80?
Right, so the 120 is the blood pressure when the heart contracts, right? So it's the blood pressure the heart contracts against. And then there's a relaxing to the heart, and that's the lower number, the blood pressure after the heart relaxes. And so the two together kind of give you a good sense of what the blood is doing kind of in the blood vessels.
And Ron, we took your blood pressure.
Yeah,
before the
because
segment.
I had
Long
sleeves on.
You
yeah,
were like
so.
taking off your tie, and but there was no like just rolling up your sleeves.
Yeah,
what was
it
yours?
mine was 76 on the low side, but I was a little high on the high side, 125. So they said that one of the reasons why might have been that I was kind of stripping in front of like a large room. So
it was putting the pressure on you.
right. So they're like, you're probably within the range, but this is something that you definitely want to kind of watch for.
So I think one thing that people need to know when they take their blood pressure, because many people take their blood pressures at home, you actually want to sit quietly for at least 5 minutes with your feet flat on the floor first, kind of think happy thoughts, and it would be best if your bladder was empty, that you didn't have coffee and you didn't smoke right before. So all of these things are really important in order to get a more accurate blood pressure.
Okay.
Well, and it is so important. And you guys actually have a free event that's going on this morning to help people
down
get
at the
screening.
US,
and
the U.S. Steel Tower. We are doing blood pressure screening as well as point of care lipid testing. So we can talk about, I will be there. Esa, you can come if you want. We will talk about blood pressure. We'll talk about cholesterol, things that you can do in terms of a diet. There's going to be lots of people there and a lot of information and resources. So
what is the lipid test that you were talking about?
So
what is that?
lipid is a point of care. We just prick your finger. We get a little bit of blood.
It's kind of like a diabetes test then?
No,
or
no
not?
diabetes.
Okay,
No, just
okay.
so the cholesterol. So
Okay, just looking
total
at-
cholesterol, it'll be your LDL, which is your bad cholesterol, and your HDL, which is a little bit of your good cholesterol, and your triglycerides is what we can measure.
You asked before about symptoms, and I saw a really interesting piece this morning about this woman who suffered a major heart attack but had 2 minor ones prior to that were kind of just dismissed, and that the symptoms can be different for women, that they may not experience that heaviness on their chest that men would experience. Is that right?
Yeah,
That's very true.
Yep. The number one symptom for both men and women is chest pain or pressure or tightness or squeezing. So that is still the most common.
Right.
But women are much more likely to have atypical symptoms, such as shortness of breath. That doesn't have any chest pain or tightness.
Right.
Sometimes they'll just say, my neck and my jaw really hurts, or maybe it's my ear, their arm, but nothing in their my chest doesn't hurt, so
Right.
it must not be their heart. And so they, or sometimes their doctors, if they're not well informed, say, oh, it's good news, it's not your heart, we'll move on. So a lot of times either women or other people say we don't need to worry about it.
Okay.
And maybe you do.
Yes, we absolutely do.
Okay, good information. Thank you all for coming on, for taking our blood pressure this morning. And remember to wear your red today and get your free heart health screening as well. The UPMC coach team will be up at the U.S. Steel building. It's Pittsburgh, in the concourse level from 11:30 until 1:30 today, offering free screenings for blood pressure, cholesterol, and BMI levels. You can also stop by to ask the expert about heart health, try some activities, and pick up a few freebies as well. Look for more details on the event and heart health on the American Heart Association's website. You'll find a link at kdka.com. I know that you guys are also trying to solicit donations as well through the campaign, so that's good stuff there. And get this, babies are also going red. We love this. Oh my
How
gosh, look at that
cute.
little cutie. Babies born in February are getting knit or crocheted red hats as part of the Little Hats Big Hearts campaign. Volunteers like the ones that we introduced you to here on PTL last month have been busy making those hats for the American Heart Association's effort to empower mothers to live heart-healthy lives and to remind children to do the same.
How cute is that?
Adorable. Love that.